guys, Dr. Anderson here, Anderson Podiatry Center, and I'm here with Tammy, who comes all the way from Wisconsin, and for her restless leg. She found out about us, I believe, on YouTube, and so this is her first appointment today. We're doing her what we call her pre-op. We did her evaluation and all that, and part of what we do is we look at her nerve tunnels with an ultrasound machine, and the really striking thing that I stress to her, and sometimes I even remind myself of how medicine treats you all that are suffering from restless legs. We did her exam, and obviously you have a less feeling down here. True, Tammy?
True.
Yeah. So, if you're watching this, I would like to challenge you. Has any doctor ever examined your legs and found out that you have numbness or less feeling? And I bet you the answer is no. Very few of you. Because most doctors are not well trained to look at and evaluate and treat the lower extremity peripheral nervous system. So that's what I do. I'm a peripheral nerve surgeon, and I'm evaluating these things because that's a big dark hole in medicine. It's really been overlooked, and you just need to know that. Look up medical research about restless legs. You're going to find very little, if anything, about it, except for the first paper we published on this, opening up nerve tunnels, and we got a second paper that's going to be published pretty soon. But the other point I want to make, not only was she showing some numbness in her legs, and her symptoms are from the knee down, and her numbness is from the knee down in certain areas, most areas. But the other thing, this was an ultrasound evaluation. And on this ultrasound, I want you to look closely. But what I did was I evaluated, and we can maybe pan down here, right, for a minute. Right here is called the common peroneal nerve. And this nerve was examined on the ultrasound. And we're looking at it from a side view, and that is the actual nerve right there. So this is skin, and that is a muscle called the peroneus longus muscle, and this nerve is diving beneath a muscle compartment, and where it dives under the muscle compartment, right where it enters under the muscle compartment, you can see it's really thin here. I think this measured about 2.9 or about 3 millimeters, and then you come beyond the nerve tunnel area. This would be going down towards her foot. This would be going up towards her hip, but that's all nerve tissue. It's the common peroneal nerve. You can see it's much smaller in dimension here than it is here. So this shows you on an ultrasound that there's actual compression going on. Physically, you're seeing the compression. So not only have we found less feeling, we've also can see this one specific area that there's tightness. And actually we can look at all these areas, and most of the time have some evidence on an ultrasound that there's compression. So I hope that was helpful, trying to teach you all about another option that you have out there. It doesn't have to be drugs and just kind of living with it, but there is this opportunity, especially if it's bad. If it's not that bad, maybe it's not the right time, but if it's pretty significant, like it is for Tammy, it's that time where she needs to consider this. And please consider reading my book, Perfect Night's Sleep, and go to our website. There's lots of good information on there about why this can help you too. And please subscribe to our YouTube channel and give us a like. And if there's any comments, questions you have at all, please feel free to do so. Thank you for watching.